Good afternoon. This meeting is being recorded. My name is Chuck O'Neill. I'm Deputy Executive Director of Administration with the Kentucky Board of Emergency Medical Services in Lexington. We appreciate you being with us on the monthly KBEMS EMS Administrators conference call. Today's April 28th, 2021. And we'll pass things off to KBEMS Executive Director, Michael Poynter.
Thanks, Chuck. And thanks for everybody taking time to join us today. I was just told that today is National Superhero Day. So thanks for taking time out of your busy schedule to join us. We've got some good updates and we still want to do this on a regular basis moving forward. So first line of operation is our office operations. If you didn't know, we relocated back in December. We're about a little over a mile from our previous location. We're on Fortune Drive, 2464 Fortune Drive, Suite 195. We have not been fully staffed since last April-ish. We are opening the office hours. We've been working remotely for the last 12 months and basically with no effects to operations in a negative way. Everything has been taken care of as usual. As our numbers decrease across the state with the virus, we'll be increasing our volume of employees here at the office. So we will be probably phasing in the next month or two where we will have somebody here physically during business hours. Right now, we do have some of our leadership team and some of the staff here during business hours to receive and send mail and packages and things like that. We've set it up where we're going to have a very good way for virtual meetings moving on in the future. I really think that this is going to be a new normal, that we're not only just require in-person meetings. I think it can be a combination of in-person and virtual. So I think we'll see that. Talking with different agencies across the state, they feel pretty much the same with that. On the COVID end, basically, we've been heavily involved in logistics for the last year with the testing and the vaccination process. With the positive numbers decreasing across the state, we will be sort of getting out of the vaccination and planning area of that. Right now, the mass vaccination sites that we've been supporting at the Kentucky Horse Park here in Lexington, in Covington, Bowling Green, and Frankfort, we will be demobilizing those in the next week or less as time moves forward. Now, one increase that we'll see across the state is FEMA is coming in to London and Henderson on the federal contract. At the London location, they'll be using federal assets through the contract for local EMS support. In Henderson, we'll be using local EMS support. So if you're in the Henderson area, you should have been contacted or should be aware of what's going on there. What we're going to do is basically change to a brick and mortar type of a scenario for this in a smaller volume. Kroger's really stepped up and helped us out. We'll be transferring the mass vaccination sites over to Kroger. There are 103 Krogers across the state. 42 of those have the little clinic also attached to that. So with those locations, there'll be 2 vaccination opportunities, and you'll be able to basically register through Kroger. Also, CVS and Walgreens has stepped up. So we were on a call with Dr. Stack yesterday, and basically it appears that most everybody that wanted the vaccine has had their series or their first vaccination at this point. So we're getting a lot of the folks that are on the fence or undecided at this point. So we'll be spreading out a little more across the state. So with that, I will turn it over to Paul Phillips, our Executive Director over Field Operations. Paul?
Thank you, Mike. So I am incredibly pleased to report that we have our lowest week as far as the personnel accountability report. I think we've been trending this way for a long time. Super excited whenever I can open this up one day and see zeros, and I'll probably do a dance here in the office. None of you all will see that though. You don't want to see it. So we've got 5 this week. So it's 1 EMT, 1 AEMT, and 3 paramedics. Man, I can't tell you, that is a testament to you guys. It's a testament to your diligence. I know this has been a long road. It's been a long road for all of us, but especially for you guys. And I can't tell you how proud I am of you. For what that's worth, it is just a big task to get from where we were 4 or 5 months ago when we had over 200 every week to a point when we're consistently in single digits, and now we're at 5, and that's just really, really, really a big accomplishment. So I wanted to share a few things about how we're doing some things a little differently this year. One thing we tried last year with our air medical inspections for the aircraft was we tried a couple of different sites throughout the state. And this seemed to work really well for both the agencies and for our staff as well. So we set up, and I reached out to all the air medical agencies. If you are an administrator for an air medical agency and you haven't heard from me in the past 48 hours about setting up your inspection, reach out to me. Drop me an email, paul.phillips@kctcs.edu, and I'll send it out to you. But I've sent out a KIMSIS notice to all the air medical agencies. We're going to be setting up 5 bases. Hopefully we're calling them strategic sites throughout the state at different geographic sites. We're open to opening more if we have 1 or 2 places that get overwhelmed. But I think the 5 is going to meet our needs. But again, we're flexible on that. So if you haven't heard from me, reach out. I think this is going to be great because we can go to a single site. We can shuffle in aircraft throughout the day, and we can really just do a mass inspection at these locations, and they'll be at airports in those areas. Have a couple of items that I want to update you all on from our field staff and different things that they are seeing when they're doing their inspections. One is an issue with the blind insertion airway devices. Want to remind you guys that these need to be for adult and pediatric. We can't just have one or the other. And adult, like, one of the requirements is that they be for all age groups. So just keep that in mind when you're stocking your ambulances, that the BIADs, the blind insertion airway devices, eye gels, whatever your blind insertion airway of choice is, that you need to have sizing for both adult and pediatric patients. 2, your KIMSIS rosters. So in KIMSIS, you have the opportunity to affiliate your staff with your agency. We need to make sure that these are being kept up to date, especially when you unaffiliate with someone, that they are being removed from your roster. This is how we verify your crew's certification status, if they're current or not. And if they're on there and they're not current, we assume that there is an issue. So we need you guys to keep those rosters updated. The final item that I have is, guys, do not wait to complete your agency renewal applications. This is going to lengthen the process for you. It's going to lengthen the process for us. And it's really at this point imperative that you guys go ahead and at least start the process. This year, we are requiring payment before you get access to your inspection checklist. So if go ahead and pay, then you can get access to your inspection checklist. And this is imperative for you guys, especially the ones that are government agencies or government affiliated, because we know a lot of times you guys have to put in check requests, or you have to go in and go through the fiscal court and get approval for an expenditure. So just keep that in mind, keep that timeline in mind. We don't want to run into a time when you guys don't have time to do the things that you're supposed to, and we end up in a bad situation. So try to keep that in mind as you move forward. I am going to hand it off at this point to Greg Hiles the K-Beams Marketing Director.
Thank you, Paul. As Paul said, I'm Greg Hiles, and I'm the Marketing Manager for K-Beams, for those of you who may not know me. So what I carry out basic marketing tasks here and do some creative work. I serve as a liaison for any media requests that we get and putting them in touch with subject matter experts here and outside of our agency if needed. And then I also do a lot of the web content management. And one of the most fun and enjoyable things that I get to do is our social media content and managing it. And I'm a social media dork a little bit, so I do get to follow most of you on there, but I'm hoping what I'm about to tell you in regards to what we have planned for EMS Week will kind of engage us even more, and that I'll be kind of more aware of what you all are doing on a daily basis, because you know, I look at a lot of pages out there, and so many of you all are doing some really cool and creative things that are just showing a human side to EMS and a relatability side. And I think that's so important. Just that we continue, the good part about our job is that we get to highlight you all and support you. And that's what we're here for. So when I talk about this EMS Week work, this is not a marketing campaign for K-Beams to be recognized. This is about us recognizing you all together. And I will, here in a second when I get done talking, I will put some of this information in the chat box for you, so you don't have to worry about jotting it down right now. But of course, for EMS Week, our ideal situation would be to have a singular event or series of events, but of course we still don't feel safe doing that at this time. So we're really going to push a heavy social media campaign this year. And you can find all of this. We set up a page on our website. It's kyems.com/EMS Week. So you can go there, and basically what we have on there are all kinds of different ways and suggestions for how you can be involved in this, because we really want everyone to come together on this and have as many of you all highlighted and participate as possible. So first of all, we started out, Paul was able to touch base with the County Judge Executive Association and send out sample proclamations for EMS Week and EMSC Day, which is the Wednesday of EMS Week, to get hopeful pickup and recognition on a local level, because that's obviously what a lot of media is really, really interested in. And that gives you maybe a chance, a better chance to be recognized in your locality. But as far as the social media aspect of it, we launched our Instagram at the beginning of last week. And of course, we have our Facebook. You can find us on both of those at KY Board EMS. And of course, we also have our Twitter channel that we use a little bit less, but we are on that at K-Beams. So as I mentioned, if you go to this link, what we're encouraging you all to do, a couple of things that get, of course, the most engagement and interaction is sharing photos and videos. So anything you all can share as far as photos go, of just, of course, any social distancing stuff and masked up things, but also just being fun and lighthearted and recognizing your employees, recognizing other important things like fallen heroes. We also would like for you all to do something maybe along the lines of, if you want to give a shout out to your EMS agencies by taking a picture of like a handwritten note of something you've done, or one of the things that I think would be really, really cool is if we could get you all to do maybe a series of 10 to 15 second videos, where as a director or administrator, you could recognize your whole crew, or your crew could even film them, obviously on your phones as a vertical video, just thanking people or saying why they got involved in EMS, why they like being a part of the EMS family, and those kinds of things. And like I said, all those ideas that go beyond that are on our website for you. So I won't go into any more detail, because I've already spoken too long probably. But if you have a collection of things you would like to prepare beforehand, you're more than welcome to send them to me by email at greg.hiles, Hiles, at kctcs.edu. And we can find a way to kind of group those together and push them out through galleries or posts or our different stories on our pages. Or if you don't want to fool with gathering them ahead of time, what we ask you to do is during EMS week, when you're posting, just make sure to tag us in your post, and then at least use the hashtags KYEMS forward and hashtag EMS week. And that way, since I get notifications anytime someone tries to tag us, I'll become more aware of your page and what's going on, be able to track that, not just for EMS week, but also to be able to go back and set you as favorites on our business page so that I can look throughout the year and be more aware of the cool things that we can really share and get out there for you all. Like I said, I will type all of that into the chat box, not all of it, but the important stuff you need to know into the chat box. And we really encourage you all, like I said, this is about supporting you in the best way that we can. And I think I could speak on behalf of all of us here at KBeams and saying, just becoming more aware of the things that you all are doing out there and see when you're throwing them up on social media, that kind of gets us pumped up too and say, hey, there's some really great stuff that's going on out there that not everybody may get to see. And like I said, it's fun, it's creative, and it's just really a way to become personable and just be recognized in ways that people may not take the time to do every day like they should. And again, I'll encourage you anytime you have anything to highlight, we would love for this to be a more consistent thing that goes beyond just EMS week. So don't ever hesitate to send me an email whenever you think there's something worth highlighting. And, you know, our content log kind of ebbs and flows just depending on the days, the weeks, the months. But I can promise you we'll find a way to recognize you somehow through the platforms that we have available to us. So that's it. And just thank you all for listening. And we hope that we can get as much of you all participating as possible. And now I will turn it over to our Director of Education, Mr. Bob Andrew.
Thanks, Greg. I'll start with NREMT. Again, they've extended their provisional certification testing for the cognitive without the psychomotor through June 30th of 2021. Anyone who takes the registry exam and receives a provisional certification can use that registry provisional to obtain a regular certification or license from KBeams. You don't have to wait until you complete the psychomotor portion and receive a regular registry certification. You can use the provisional. So I wanted to get that out there again. We get a lot of questions on that. A lot of folks don't know this. If you hold a provisional certification and you're waiting to obtain your full registry before you apply for Cert license with us, you don't need to wait. Use the provisional card. The provisional certifications with registry will remain valid through them up through December 31st of 2021. Or until the EMS provider passes the psychomotor exam. So you want to get that done. If you hold a provisional, you want to get that psychomotor testing side of that done with registry by December 31st of 2021. Whether you complete that or not with registry will not impact your KBeams Cert license. So example, I hold a provisional EMT certification with registry. I apply for initial EMT today. Tomorrow I receive my KBeams certified EMT card. I'm good, regardless of what happens with my registry card. We only require that for your initial entry into the system. EMS TEI renewals for 2021 were completed on April 1st of 2021. The TEI audits were underway, as I mentioned, while we were in the TEI renewal period. They're selected randomly from Image Trend. They send us a list after we request it. We're nearly done with those. I'll be emailing TEIs that are being audited about the status of their audit. TEI pass rate notices were also sent out to the TEIs that renewed in 2021. They had a first-time pass rate below 50%. So if your TEI renewed and you were a level TEI and you didn't receive an email from me about your pass rate being below 50%, then you're good. And if anyone has any questions about that, they can contact me. Courses online through train.org. Again, we have pediatric abusive head trauma on there, thanks to Morgan Scaggs and Kentucky EMSC. And we have a first responder Narcan administration training in cooperation with Kentucky DPH. It's an hour-long course that meets the FR Care grant participation requirements. For those of you on the call in Eastern Kentucky, volunteer fire departments and EMS services, there's some other eligibility. This would be the training course that you would take to meet that requirement if you needed it. CE requirements, if you go to our website, kyems.com, in the gold banner, click on education, then continuing education, you'll find some new guidance for the 2021 continuing education that would go along with the renewal cycle that we're planning to open on July the 1st of this year. And folks have a lot of questions about the CE requirement for 2021. We're still in the emergency regulations. I think Chuck's going to address that a little later in the call. And that being said, that the continuing education requirement during the emergency regulations is been lifted for the relief from the COVID issues of meeting in person in classes that are not available. However, we entered into that agreement, thankfully, with JBL Learning, and they were gracious enough to create a specialized continuing education package for Kentucky that meets the core requirements. We're highly recommending that folks, if not able to get their full CEs, even though it's not required, that they at least take the core refreshers that we have on here. It's $1 credit hour. I don't think you'll find that anywhere else, and it's high quality. So I highly recommend those. Another up and coming with that, and I'm pleased to announce, is I've been working with them on an NCCP package through that would meet National Registry continuing education requirements for their core. And we should have that online and available through our website next month. So next month, check the continuing education under the education page, and hopefully we'll have our NREMT NCCP package up, and it will be priced affordably as well. JBL Learning also has some other bulk packages that have significant price breaks that I discussed with them. So service directors and folks who are trying to train a lot of people in our organization, reach out to me if you're interested in that, and I'll provide you with the contact for JBL Learning. And from what I hear, it's a very affordable bulk package that would meet all your CE requirements, especially during the COVID. We're putting a tremendous amount of work into helping you with your education needs because of COVID. The sexual violence awareness training course is another area that I get a lot of questions in, and it's justified. I'm working with the Kentucky Association of Sexual Assault Programs, and they're updating the PowerPoint presentation, and that's what we're waiting on. They're going to release that to me hopefully the first part of May. As soon as I get that, I'm going to develop the online package. I'm certain that we'll have that online in June for folks to take on through the train system. We won't be enforcing that sexual violence awareness training continuing education requirement until 2022 because it's not readily available, and it will be online in June of this year. The other question folks have is, are we going to do any more train-to-trainers? I've asked the Kentucky Association of Sexual Assault Programs to do another train-to-trainer that I told them we would host completely for them online, and they've agreed to do that. So hopefully in the next 3 or 4 months, I'll be able to send that out. And that means anyone who would be interested in teaching the sexual violence awareness training at their service or for others who want to have it face-to-face, you would just attend that training. All certification licensure cards, we're up to date on that. I keep mentioning that because that was a point for us a few months ago where we had gotten behind on those because of COVID. We're up to date. We're going in once a week and mailing cards out to the providers. A reminder, anyone that was issued a Cert or license under the emergency COVID no fee period in 2020 was not issued a hard copy card. And we were not issuing hard copy cards to those folks. There was no fee. So you do have a PDF copy of that card in your KEMSIS account under documents that you can obtain. You'll also find yourself on the public lookup, KYEMS.com at the top of the page above our banner. Click on verification and search for yourself. If you want a card and you fall into that category of no card issue, then you can fill out a duplicate card application and pay for one. I'd recommend the PDF and wait till you renew. Castle Branch COVID-19 delays, we believe have been resolved. We've been working hard with them to eliminate these county searches that are holding up initial background checks. I want to mention again to the service directors, if you have anyone that's in the initial category with us whose Castle Branch is being held up, please contact me so I can reach out to Castle Branch, and we'll do what we can at K-Beams to get that background check freed up and moving. Chuck O'Neill, our Deputy Executive Director, who handles the legal affairs, has been working hard on this as well, and we're checking folks in the statewide system to help move this along with Castle Branch. So don't sit on those. I'll help you move them. But just know there are some cases that we are not able to resolve, and they will have to go through that process because of just unique issues with the individual. We're revising the K-Beams HIV/AIDS course. That was the course that Kentucky SFRT allowed the board to duplicate and use, and it's the board approved. It's been revised by Kentucky SFRT. They sent it to me. We're going to take it down from 2 hours to 1 hour. I know I mentioned this on the previous call, but because of work, competing work priorities, this has been moved down, still on the list, and it's up and coming. It'll be online through Train. We're still operating under the COVID-19 emergency regs. I just highly recommend everyone that's looking for certain license to go to the website, KYEMS.com, the COVID-19 Health Alert banner in red under our gold banner. Click Read More, and all of the checklists, the new ones are on there. Go there to look for the requirements now for certain license and the emergency regs. Further down are webinars that Paul Phillips, the Deputy Executive Director, did for the services, and I did one for the training centers and related. Please view those. Those should answer the majority of your questions. Changes to temporary. We mentioned this in the last call. So all COVID-19 emergency temporary cert and licenses that were issued had an expiration date on there that was, I believe, a year. We changed those on February the 17th when we updated the emergency regulations to all of those expiring on the same day. If you hold a temporary, it will expire on October 1st of 2021. I'll say that again. If you hold a temporary cert or license with K-Beam, it will expire on October 1st of 2021. Everybody can get that. EMS providers that hold that temporary need to do one of two things. I recommend complete your NREMT psychomotor testing before the June the 30th provisional runs out, so you can get your registry and then get your certification with us. Or you would fill out a downgrade application through your ChemSys account to return to your previous cert or license that you had with us. Most questions, again, can be answered from our website. Then we recommend the support ticket portal, especially for anyone with certain license application questions, or how do I become this, or how do I do that. It's okay to contact us, by email and phone for things that fall outside of those categories that are difficult to answer, but we really appreciate it when you first visit the website, then do a support ticket, and then reach out to us. And that's all I have, Chuck. I'll hand it off to Monica. Thanks.
Good afternoon, everyone. Thank you for joining us. If you were on the call last month, then you might remember me announcing that K-Beams has been working on several different incident data reports. And this past week, we actually just released one of those reports for you all to view and for the public to view as well. And that is a 2020 STEMI incident report that we worked on with the Cardiac and Stroke Care Subcommittee. If you're interested in viewing that report, you can find it on our Facebook page, or you can also find it on our website. You go to kyems.com, and on the homepage under the News and Events tab, you can click on the 2020 STEMI incident report. Within the report, just give you all a little brief view. We're looking at STEMI incidents by scene county. There's some different response time metrics listed in there. And if you all have any questions, feel free, send me an email. My email is monica.robertson@kctcs.edu. I did want you all to know, though, that within the report, the inclusion criteria that we use to determine a STEMI incident was created by the Cardiac and Stroke Care Subcommittee subgroup on STEMI. So I know several of the agencies have reached out to our office wondering what criteria we use to pull this data because it's looking a little different than their criteria. And most of these agencies are utilizing ESO. So we realize that inclusion criteria is different. So we have republished the report with an added page with the inclusion criteria that we used. So like I said, if you all have any questions, please feel free, give me an email. And in the upcoming weeks, we will have more data reports released. We're working on some stroke data, some compass measure data, the annual report, just a lot of fun things going on right now. So just be on the lookout and let me know if you have any questions. Thank you all so much. And I will hand it off to Morgan Scaggs.
Hi, thanks, Monica. Just a couple of quick notes for everyone. I know some of you are waiting the results of your application for the Pediatric Recognition Program. We did have an unavoidable delay in the meeting for the EMSC committee. And so I had hoped to have the results last week, but the vote will take place in 2 days on Friday afternoon. And so I'll get in touch with everyone as soon as possible after that. And then, of course, we will have some social media posts and some other things to help share that news. Our official press release version goes out on EMS for Children Day in May. So stand by. I think we have 24 applications in that I expect to be approved. And so we'll have more information on that shortly. We did hold the hand-heavy instructor class last week. This was rescheduled from March of 2020. So we were really happy to get that class off the ground. We had 24 participants over 2 days, and everyone seemed to really enjoy the class and find it extremely valuable as changing their approach to pediatric resuscitation in particular, but then for those who have adopted the hand-heavy system, also giving them some additional information and ideas and education to share with their staff. We do hope to hold another version of that class either later this year or early next year. So if there's anyone within your service that would be eligible for that program, I need to get their name on a notification list because we do anticipate that those spots will be limited. And with our program picking up 2/3 of the cost, it's a great opportunity to get that training at a much cheaper fee for you or individually or for your department, depending on who's going to cover that. I did include a link earlier towards the beginning of the meeting and just now in the chat, but also agency directors in particular, look out for it to come to your inbox. It's a short 2-minute video that I created that covers a few highlights of our program, really focusing on some things you can do to improve pediatric care. And I do want to point out that, that's why our program exists, to support your efforts to improve pediatric care. And in the last 3 years, we've provided more than $140,000 worth of pediatric equipment, education materials, and other opportunities to providers here in Kentucky. And so the more you're engaged with us and the program, the greater the chances are that you're going to know about those initiatives and have an opportunity to participate. I do have to mention that, half of my work is focused on hospitals and improving emergency department care. And we did just acknowledge 2 new hospitals as having pediatric ready emergency departments. So we want to welcome Ephraim McDowell Fort Logan and Ephraim McDowell James B. Hagan hospitals to a total of 7 now that are recognized. The other facilities include Ephraim McDowell Regional Medical Center, Pikeville Medical Center, St. Clair Healthcare, Norton Children's Hospital, and Kentucky Children's Hospital. So we do support their efforts. And if you need any assistance in making that connection with the hospital coordinator for pediatric care, we would be happy to help facilitate those relationships as well. So as always, I'm available by phone or email most of the time. So if you have questions, please reach out to me. And that's all I have for you today. I believe Chuck is next.
Thank you, Morgan. This is Chuck O'Neill again, and I'm going to provide you with some regulatory updates and a few other pieces of information. The 201 emergency medical responder, 301 emergency medical technician, 330 advanced emergency medical technician, 401 paramedics, 601 training, education, and continuing education, and 540 data collection, management, and compliance regulations. Those 6 regulations were filed with the Legislative Research Commission on April the 15th. The public comment period on those has not opened yet. The public comment period on those regulations will open on June the 1st and run through June the 30th. We will have a public hearing on those, which may be remote through Zoom or hybrid or something like that, tentatively scheduled for June the 28th at 1 p.m. Eastern Time. If all goes well, those regulations should be effective in the vicinity of November 2nd. So we're excited about getting all of those regulations to the LRC, and appreciate Bob Andrew and the Education Committee, and Drew Chandler and the Data Collection Committee here at K-Beams in their hard work in working with stakeholders to eliminate any issues that our stakeholders had with the way the regulations were written. So we think we've got some really solid content that's going to streamline a lot of processes for you when operating your agencies. There is a 030 fees regulation that the board and the executive committee have been discussing for a few months. Those are currently actually being drafted. The community paramedic, advanced practice paramedic regulations are also being drafted, as well as the wilderness paramedic, advanced practice paramedic regulation. Those are being drafted by a task force set up for wilderness. Also in pre-draft phases, which means that we haven't begun it yet, but it's next on the agenda, is a regulation for medical control documents that will put some timelines on the state medical advisor and the medical oversight committee and board for approval of medical control documents and protocols. That's all I have on the regulatory side. I was notified that the state health plan through the state is currently in a public comment period. The state health plan is a 2-year plan that's released in the form of a regulation every 2 years by the State Department of Health and Office of the Inspector General. What may be important to you as directors and administrators is that the state health plan includes the provision for certificate of need for ambulances, for ground ambulances. And it's my understanding that during the public comment period, there are certain special interest groups that are interested in submitting public comment during this state health plan public comment period in regard to removing ambulances from the certificate of need process. So I wanted to notify you of that. I was just notified of that today. Some of you may already have that information, but the public comment period closes on April the 30th. So if you have public comment to submit in regard to the state health plan or support for continued certificate of need for ambulance services or support in a different manner, that public comment will be received only through the 30th of this month. So we'll need to get to that. Next on the agenda for me is just an update for you. I know several agencies are waiting for protocol approvals, and our new state medical director, Walt Lubbers, is on board and going through the onboarding process and has already begun looking through protocols. We can't give exact timelines on when those will be approved because they're backlogged quite a bit, but I can promise you that we will get those approved and communicate with those agencies that have protocols outstanding just as soon as we possibly can. And Mike Poynter had something else to add, so I'm going to turn it back over to him. And if you have any questions, one thing I had on my list I missed, I'm sorry. Bob Andrews spoke earlier about the emergency orders. We have a plan now to sunset the current emergency orders as of December the 31st, 2021. All of the current emergency orders that K-Beams has in place to replace ordinary administrative regulations will be in place until either A, the governor rescinds his emergency order, giving the board the authority to draft emergency orders. And if the governor does not rescind that before December 31st, Mr. Poynter is going to rescind or sunset the emergency orders that are currently in place, and that will occur on December 31st. So as of January 1st, 2022, unless something else happens, like the governor rescinding the orders, or if there is some type of outbreak that requires us to extend those, they will be sunset on December 31st, 2021, and all of K-Beam's ordinary administrative regulations will go back into effect on January the 1st, 2022. And I will turn it back over to Mr. Poynter, and if you have any questions, put them in the chat for us, and we're going to do everything we can to answer those for you.
Chuck, do you want to go ahead and entertain those questions, and I'll close this out.
Sure thing. Sure thing. Okay, the first question is from Rick Luperfido. Rick wants to know, will there be any changes to in-service education requirements for medics and EMTs this certification period 2021? And are we back on track for the number of CEU hours required? Bob Andrew, Director of Education, would you care to take that one?
There'll be no change as from 2020. We're still in the emergency regs, as I mentioned on the section I did. If you want to, Rick, go to our website, kyems.com, click on education in the gold banner and continuing education on the left. The top section, it explains it, and there's a new 2021 provider CE guide, and we're still in that period of it's not required but highly recommended. And below that, the online refresher course options are listed through JBL Learning.
This one's from David Geiger. Is there a link to the 202K R7 601 proposed changes also for 301 and 401? David, there's not currently, they're not online. I checked the LRC's website. What we normally do is put those draft regulations on our website, but it's a hyperlink from the Legislative Research Commission's website. They haven't posted them yet. They're filed on the 15th. And so what we may do in the meantime, so people have more time to look at it before the public comment period opens on June the 1st, is we do have the ones that were filed. They're just scanned copies with the signatures and the stamps and everything. But I'll work with Greg Hiles, our marketing director, to get those linked and up on our website for yours and all of our stakeholders review. But it doesn't look like the LRC has them up yet, but we'll try to get that done this week. Next question is from Rick Luperfido again. If I would make the decision to utilize EMTAs at my service and utilize the Kentucky State Protocol, what's required for me to submit to K-beams? Paul Phillips, you want to take that one?
Rick, good question. So there's a couple of different things at play here. If you already utilize the state protocol, nothing is required of you because there are provisions in there for EMTAs. Now, if you are not currently utilizing the state protocol and would like to move to the state protocol, then you would need to put in a medical protocol application in KEMSIS to adopt the state protocols. But those are your two options. If you're already utilizing the state protocols, nothing's required because there is a provision in there. And if you want to move to them, then just put in an application.
Thank you, Paul, and thank you, Rick. Don't see any additional questions right now. So I want to thank you all for attending today and being with us and continuing your hard work daily to operate great EMS agencies across the state. And Mr. Poynter is going to close us out. And Mr. Poynter, you've got it.
Thank you, Chuck. I really hope this call helps everyone with real-time information. I know that's always been a challenge for any state agency. If you have ideas, please reach out to us. I know 2020 really threw us off the rails, and we're getting back on the tracks, and we're taking a little different view moving forward. EMS is what we make of it. Whichever direction we go, it's our fault. And I want to solicit, as we move forward, your engagement with us, with our office, with our board. As we move forward, as I mentioned before, I really believe that the changing atmosphere of meetings, in-person meetings, will never be the same as it was before. We're looking at new ideas. We have a foundation now in Kentucky with our data program that very few states have. And we've got the expertise to really make some good things out of this and help you out as a resource. So I want to solicit, as we move forward, your engagement with committees, groups, anything. There's no travel. We're going to set up everything virtual. We'll have our office set up where we can do virtual meetings, group sessions, things like that. So think about how you can engage with the state office. Like I said, I'm asking for expertise. Most of us come from a street background, EMS background, but we haven't been out on the street in a clinical setting in quite a while. You're out there every day. You know what's going on. You know the changes. So please reach out to us if you feel like you can help move EMS forward in any way. So with that, I will close out from Lexington. I'm showing 2:50, and we're out at K-beams. Thank you very much.